Welcome back. If you're still wondering about the popularity of neurotoxins and dermal fillers, the numbers don't lie. According to the American Society of Aesthetic Plastic Surgery, Botox topped the rankings of the most popular non-surgical cosmetic procedures. Brad, you do a lot of facial rejuvenation. Do you have any thoughts about what the top 3 things are that patients like?
Well, thank you, Christine. I think that, these are still procedures, and so I tell all my patients to expect some bruising and swelling. Don't have a big event the next night, just in case you have a little bruising and swelling, but it's quick recovery and, painless recovery for sure. I think importantly too is they come in usually complaining of wrinkles, and then I sort of have to look at them and sort of re-educate them about volume and shape, because I think facial aging is about a loss of volume. And so whether restoring volume in the lips or in the cheeks or in the nasolabial folds, wherever, it's about restoring volume, and that gives a restful, youthful look. And I think lastly, I've been doing Botox for 16 or 17 years, and nothing can replace experience. And so for me, making sure that the patient gets the right treatment from the right doctor who knows what they're doing and has a lot of experience with it is the guarantee to having a better result. These products always work. They're great products. I use them myself, my staff use them, my family members use them, but only in the right hands can you have a great result.
So Brad, who do we have that's joining us today?
Well, this is Gail, our volunteer today, and she and I have already had a discussion about what she would like to see improved. And so as we went through, she doesn't like the 11s between her eyebrows. Also, the forehead line she's a little bothered by, and also the crow's feet. And so we'd like to address all of those through use Botox. You could use Dysport as well. But more importantly, when I think about using a toxin, is that I can actually change the shape of her eyebrows and in her forehead. So where she's talking about wrinkles, I'm thinking, how can I recontour and how can I make maybe the brows go up a little bit and give her a better look? So we're planning for her to do Botox a little bit in the central forehead, into the 11s, and then also a little bit into the crow's feet. This should give her a nice brow elevation, help her with the fine lines and wrinkles that she doesn't like. And so we're gonna start there. So these are the Botox injections. This is into the 11s, and these injections are very, very quick, but very precise. We're going into the muscle called the corrugator, and then I'll also do an injection, in the area that's between the eyes, the frowns as well. And that's how quick it is to do this injection. She would like to have slightly fuller lips, but she also would like to have a reduction of the wrinkles. She definitely does not like the parentheses around the mouth. We call them nasolabial folds. And for me as a surgeon, I see the loss of volume in her mid-cheek and her submalar region, the area below the eye extending out to her cheek. And I know that if I add volume there, it will give her a more restored, youthful look, more restful look, but also it's going to soften the folds that she doesn't like, called the parentheses. So we're going to use Juvederm. It's a hyaluronic acid. It does great on the fine lines. It actually is going to restore volume. So think about this as initially restoring volume. So I'm going to start here, Gail. So it's going to have a little sting to it. And the lips are a little bit more, tender to treatment. Fortunately, these days, these products have lidocaine in them. So they have numbing medicine built into them. And that's just recent over the last year or two. So once you start to do the injections, some of the numbing medicine is present in the product and it starts to make it much more tolerable. So as you see, I'm moving along the lip line initially. We call that the vermilion border, because I'm trying to just give more definition to her lips. This is an area where patients complain that their lipstick goes up into the lines, and they get bleeding into the lines, they don't like it. So I think if I strengthen that fold without overdoing it, it can be excellent. If you overdo that fold, then it looks very unnatural, and that's the person that looks like they've had an augmentation of their lips that they don't like. We definitely don't want to create a ducky look. Next for Gail, we want to restore cheek volume, which will help with her nasolabial folds, these parentheses around the mouth, as well as just give her a more youthful volume. And so we're going to do that with a product that I use that's called Radiesse. It's a calcium hydroxyapatite. It's a little thicker product, so it's a product that I would actually use only in deeper areas of the face. You ready? Mm-hmm. Okay.
So as we age, Brad, what actually happens? What do we lose? Muscle, collagen?
Well, I'm going to tell you, you lose a little bit of everything, muscle and collagen and fat. And you lose volume. And in the face, you lose bony support a lot. And that's where this can come in. You lose a lot of the bones just get smaller. If you look at dental x-rays, you see there's less bone present. And with that, we see a deflation of the soft tissue overlying the bone. And I think that is enough for one day.
Mm-hmm. You look great.
And but not overdone at all. I don't think anybody would look at you and think that anything's been over-injected or overdone. You'll be surprised how much volume you can actually tolerate and still look excellent. And we did it very quick. I mean, even doing this as an example, I think maybe in just 15 minutes or so, we've given you a lot of volume, a lot of restoration. How'd you do?
Not bad.
Not bad? Are you
Not
glad
bad.
you're glad it's over, right?
Absolutely.
Yeah, exactly. Okay.